Guillain-Barre syndrome (GBS). It is an acute radiculopathy or polyneuritis. Pathologically, it is acute inflammatory demyelinating polyneuropathy, or the your AIDP, or AMN, AMAN, acute motor axonal neuropathy, or AMSAN, acute motor sensory axonal neuropathy. That means, for unknown reason, or some infective process, Clostridium jejuni in one-fourth and one of the adult cases. In children also, Zika virus, chikungunya virus, and this group of disorder comprises 70% of the your Guillain-Barre syndrome infective cause. Apart from that, vaccination with rabies and influenza can incite the GBS, but good amount of time it is idiopathic. So the clinical presentation is acute ascending weakness, paralysis, followed by the paralysis by 1 to 6 weeks. The patient has hyporeflexia, there can be cranial nerve involvement, and there can be autonomic dysfunction. Good amount of time you do have respiratory failure. Brainstem encephalitis is possible, and a good amount of time you have the EEG changes, and the CSF finding your higher amount of protein in the CSF with normal cell count. Albuminocytological dissociation is common and diagnostic of Guillain-Barre syndrome, and the nerve paralysis is evidenced by the electrophysiology, nerve conduction velocity, and electromyogram (EMG). So, and good amount of cases in adult cases mostly MRI is needed to exclude the cranial intracranial lesions. How these cases are being treated? Symptomatic and supportive care with the feeding, your pain, nutrition, and your blood pressure. Hypertension is possible in those cases, and then the autonomic hypertension. So taking care of hypertension, infection control, and passive movements. And specific treatment, should I say, IV your IG plasmapheresis. Well, in our early days, the methylprednisolone, oral prednisolone was the practice. Now they say the plasma exchange and IVIG for 5 sessions of plasma infusion exchange, and IVIG few shots are said to have good amount of recovery. More than your, it may take longer time. At times, it may take 3 years even, but acute stage is recovered most of the time. And with patients who need ventilation for respiratory failure, lung involvement, severe sort of lung involvement, brain involvement, they may need longer time.